Assalamualaikum and good morning to our beloved lecturer, Sir Raizal. I'm Muhammad Aiman Amirun bin Muhammad Ashraf, and then this is our group member, Muhammad Airil, Muhammad Adib, and Stacy Moses. So today, our group gonna present about National Strategic Plan for the Control of Tobacco and Smoking Product. For introduction, the National Strategic Plan for the Control and Tobacco and Smoking Product 2021 until 2030 is a policy strategy aimed at enhancing tobacco control and regulating smoking substances in Malaysia. The scope of the plan encompasses various strategies and initiatives to control tobacco and smoking products, including addressing the challenges posed by new smoking products like electronic cigarettes. The plan highlights achievement from previous tobacco control initiatives such as the development of screening and intervention programs for youth smokers, the establishment of new non-smoking areas, and the enhancement of smoking cessation services.
In this policy, they stated several problems, which is high smoking prevalence. Despite efforts, smoking rates remain significant, especially among certain demographics, posing ongoing public health. Next, new tobacco products. New tobacco products like e-cigarette and vaping device complicate tobacco control effort and have unknown long-term health impact. Next, cultural norm and social acceptance. Smoking is still socially accepted in many communities, making it harder to implement control measures. Next, enforcement and regulation. Existing law and regulation need strengthened to effectively control both traditional and new tobacco products. Lastly is public awareness and education. There is a need for increased public education to change perception and behavior related to smoking. The objective of this policy is, first, reduce smoking prevalence among women, maintain smoking rates among women aged 15 and above to less than 5%. Next, overall smoking reduction. Decrease the overall smoking prevalence to less than 15% by 2025. And lastly is endgame goal, which is to achieve the tobacco endgame by reducing smoking prevalence to less than 5% by 2024.
For the strategies, community empowerment is a key aspect of the National Strategic Plan for the Control of Tobacco and Smoking Products 2021 until 2030. This strategy focuses on engaging and empowering communities to take ownership of tobacco control efforts. Multiple sectoral collaboration plays a vital role in the implementation of tobacco control strategies. The Malaysia Quit Smoking Service, which is MQuit services, are empowered through smart collaboration with professional bodies, non-governmental organizations, and private agencies.
As can be seen, one of its strengths is multi-sectoral collaboration. As stated in the strategy, multi-sectoral collaboration enhances the effectiveness of tobacco control programs and facilitates the sharing of best practices. By using this approach, each sector can share the knowledge, expertise, and resources which can benefit them in the long run for catching up to their main objective. This plan involves collaboration between the Ministry of Health, Ministry of Education, the Ministry of Communication and Multimedia, local authorities, NGOs, the private sector, WHO, and also Asian. The next strength that can be highlighted is it's aligned with the global objectives. World Health Organization Framework Convention of Tobacco Control WHO FCTC is the first international agreement established under the WHO. It was created to counter health problems that were caused by smoking, which was a global problem. This convention represents the achievement and raises public awareness about this serious health problem. Also, it provides new legal direction for any cooperation at the international level. Other than that, it is a data-driven approach. The Ministry of Health used data from the national survey, the Global Adult Tobacco Survey, to identify the demographic that shows the high rates of smoking, the most popular tobacco product, and also the general public's knowledge of the danger of using tobacco. Through efficient use of data, the plan can make sure that its approaches are supported by evidence, centered, and also flexible enough to adjust to Malaysia's changing tobacco environment. Next is the weakness. As we all know, limited resources are the main weaknesses for a policy to be implemented perfectly. Limited funding is always the main weakness for any policy to be successful on a bigger scale, provided resources may not be enough for effective awareness initiative, law enforcement programs, and also accessibility to smoking cessation services. Resources can be in terms of financial, workforce, technical, material, and so on. Thus, limited resources can delay the process and also the effectiveness of this policy implementation. To put a solution around this, policymakers should evaluate the implementers' resource and capacity gaps and needs and then provide them with the necessary encouragement, guidelines, or compensation. Next, public education. Gaps can also be one of the weaknesses for this policy to success in implementation. This is due to the demographic of rural areas where certain places do not have any access to modern technologies like phones, the internet, and so on. They may also lack in terms of healthcare resources and also educational programs in contrast with the urban area. Not only that, low-income groups, the bottom 40, might also prioritize their needs such as foods, clothes, house, etc. over long-term healthcare. Enforcement challenges are also one of the weaknesses of this policy implementation. This is because the Ministry of Health and also local authorities are lacking in terms of workforce. Thus, it can affect enforcement activities like doing a regular inspection in public places.
So today I will going to present about recommendation. So in recommendation, there are three types of recommendation, which is for the first one is strengthening the tobacco taxation and pricing policy. We can say that rising tobacco taxes and implementing a minimum price for tobacco products can significantly reduce smoking rates, especially among youth and low-income groups. The additional tax revenue can fund tobacco control program and improve public health. And for the second recommendation is implement the smoke-free area policy. This is what we can say that to protect public health, Malaysia should establish smoke-free zones in all public places, workplace, and transportation. This policy will reduce exposure to harmful second-hand smoke, leading to improved health in outcomes. Expanding smoke-free regulation to outdoor areas like parks and recreational facilities is also crucial. Strict enforcement of these laws, combined with public awareness campaign, will create a social norms against smoking and promote a healthier lifestyle. And for the last recommendation is strengthen tobacco enforcement, which is to improve compliance with tobacco laws. Malaysia must increase enforcement efforts. This includes stricter monitoring, heavier penalties, and collaboration with other government agencies such as law enforcement authorities such as custom and local government. This will encouraging public reporting and protecting whistleblowers can also help. So for the next slide is conclusion, which is we can conclude that it is essential for all stakeholders to work together to protect public health from the harmful effect of tobacco product. Malaysia National Tobacco Control Plan provides a roadmap to reduce smoking rates by offering increased support for quitting. This strategic approach aims to create healthier future for the country by effectively addressing tobacco use. That's all from me and our group. Thank you.